ended up costing 1,225. So we have a balance of 3,275, and that hasn't been paid out yet, but it's in process. Um, Annabelle applied for the vacancy in District 3, and I've gotten a message from um, Chris Kersey that she will be appointed. So we'll have a full board. The approval of the minutes of January 19th will happen at the February 16th general meeting. And the draft minutes will be sent out. Special topic presentation. We really need to discuss that, but I think that I'm hoping that other people come. So if it's okay with you guys, we'll just put that until um, they show up, hopefully. Um, I know that Bill, I believe he was intending on coming to this meeting, but um, I know he can't come in February. So
No, it's
um,
this meeting he can't come to.
this meeting he can't
This
come to.
one.
So
Yeah,
he
he's
can't
got a
come.
conflict, but he
Okay.
should be able to make it to the mental health board meeting.
Okay. Um, so Sherry and I, over the years, have been noted. Well, we noted that several years ago, the drug and alcohol board um, was disbanded. They just simply didn't fill any positions on it, and it disappeared. So right now, Bill is in charge of both behavioral health and drug and alcohol. Um, but there is no board representing the drug and alcohol section. And so some mental health boards, some behavioral health boards have taken on that role as well. And we haven't. And so Sherry asked the question, um, what is our role with drug and alcohol? Do we have one? So um, that's really a question for Bill. So I think it's something that we'll have to talk to him about. And so we'll bring that forward to the next executive meeting. Um, Number 6, the dates for the mental health board to present to the board of supervisors. That has been moved forward to March 2nd. Oh, good. There's Betsy. So the date for that presentation's been moved forward to March 2nd. And I submitted an agenda submission. I mean, we finally know how to do it. Thank you, Tori, for asking. And so I made this submission, but I haven't heard back. Well, I did. I got it back for an amendment, and it was actually when I sent the first one in. Um, I guess that what I had presented, what I had submitted, was maybe aggressive in tone. Um, it was truthful, but I did revise it to have gentler language, and that's what Becky presented. So I think um, that aggressive language is an issue, and it wasn't that it wasn't true because it was very traumatic, the financial impact and all of that, but just the statement that it was traumatic. seemed to put people on the defensive. So I changed that and just took out some of my descriptive adjectives. And I think that that was helpful. So Becky presented that, and I, will they're putting it on the consent calendar, putting this on the consent calendar. So it's really not um, it's really not a formal presentation that she's doing. She's talking during the public comment about the submission. So I guess that's, we get what we get there. So at least we're talking to them. And thank you to Becky for that. So let's go back to the special topic since Betsy's here. And hi, Betsy.
Hi, good morning. Sorry I'm late.
That's okay. There, I had trouble getting in, so maybe other people are too.
Yeah, I'm having technical issues. I had to log in through my phone because my computer is just not taking it.
Oh,
Mhm.
that's cool. Okay, so Betsy sent me a description, and I think, did you send it to Tori as well, or was it just me?
No, it was just you, Carol, and Becky.
Okay, so so I have a description, and maybe we all need to look at it, but maybe we'll see. You guys can decide. So the presenter is Dr. Daniela Dominguez, and I hadn't had her name before. I looked her up, and she's a professor at San Francisco University of San Francisco, and research director at Hannah's, and a psychologist. And the information that Betsy sent me, you think, I'll just read it, and you guys can tell me, I think that when we put it out, that we may need to look at the language, because I looked at it and said, I'm not sure that I would listen, because probably because of my bias, and but the description that Betsy sent, white supremacy refers to a political, economic, social system of domination. The system of domination is present in Sonoma County, and it is associated with racism and racial trauma. So for me, white supremacy, when I think of it as a group, a thoughtful decision, maybe that's called explicit bias, where you actually think about it and you become a person with that belief. So I get that as a white person, I have a bias, and that probably, just from my upbringing and from living in this world, that I probably have some racism, but I don't think that it's a purposeful decision on my part. My purposeful decision would be not to be a white supremacist, and to attempt not to be. So I think that when we put this out as as her topic, what I would think, instead of using that terminology in advertising, I mean, she can explain what she means by it,
Right.
but I would think that something like Dr. Dominguez will be presenting to the Sonoma County Mental Health Board on Tuesday, February 16th. Her topic will be addressing racism and racial trauma in Sonoma County and presenting strategies to achieve racial healing. Does that sound?
Yeah, that sounds good to me.
And it takes the white suprem. I mean, she can use the term and explain the term, but
Mhm.
I think that as a white person who I don't feel like I'm a white supremacist in the way that it's being used now politically.
Mhm.
I don't. I would feel like I might not listen to that presentation.
Right.
So, does that sound appropriate to you to put it into the to put it out to the public as addressing racism and racial trauma and presenting strategies to achieve racial healing?
Yeah, that sounds good to me.
Is that a good description?
Yeah, I would say so. And I think I would say that Doctora Daniela Dominguez is all would be okay with that as well, because that's what she's covering, but she's calling it out, white supremacy. And she'll have an explanation because there is some science to what she says. So I think it'll definitely be explained further so that it doesn't hit hard.
Yeah, I think that if you put it out as she's going to be talking about white supremacy, that there are people who are going to say, well, that's not me, and they won't listen.
Hmm.
So, but if you're talking about racial, when I say racism and racial trauma, people relate to that
Right.
um, more. There's more people that will relate to that than um, the other. Although at the end, you know, depending on what she presents, um,
Yeah.
you know,
And she asked me to ask
uh,
if it would be so, because I told her I actually had not witnessed a presentation like this in the past. I was part of the retreat, and the retreat was exclusively for us, right? The mental health board. And so she'd like to speak directly to the mental health board and work with the mental health board during that presentation. Um, but we knew, knowing that there are guests that are witnessing the presentation, but can the interaction be only with the mental health board, or does it have to include our guests?
our guests, um, even at the retreat, we had no guests,
We
but
didn't know.
we didn't have any guests. But even there has to be opportunity for public comment. We
Got
don't
it.
have to respond, but they have to be able to comment. And
Okay.
um, they may well have questions, and that's, it. It's not that we have a question and answer session, but
Hmm.
they have to be able to comment.
Got
And
it.
I know that we will have guests at a
Yeah.
regular meeting. So
Yes.
it's not, the answer is really that it's not a retreat type thing,
Right.
that she makes her presentation
Hmm.
and we can limit, question and answer stuff to us, but the public has to have the opportunity to comment.
To comment. Okay. Yeah, that's fine. I think she's looking at that question so that she can plan her agenda, and the activities that she may engage with us, because her approach is like I said, interactive. And so it's not just lecture, it's, work with the board. And so if she needs to take time to take questions and comments, she wants to allot that time, but she'd really like to focus on the work with the board.
And the other thing that we can't do is like breakout rooms. It all has to be publicly viewable.
Right. Yes.
So It's all, whatever she does, it's right out there in front. And
Yeah.
yes. So,
Can I be heard?
yes.
So I have, I think if we were talking about this 2 years ago, that the whole issue of white supremacy is now so incredibly huge in this country and so much more present as a result of the last 4 years. I actually am more attracted to the conversation because she uses those terms, because I want those terms to get defined over and over again, and the extreme danger that we're facing as a result of it. And I didn't hear that I didn't hear in what you said, and maybe if you read it one more time, I
didn't read all of it. So would you like me to read all of it?
And I can send it out as well. Would you like me to send it out to Tori so she can send it to you,
Sure.
Bob, and Patricia?
Okay, that would be great. And I'm always, I think it's her presentation, and there's a reason why she's putting those words in there. And I don't know if she's, I just have trouble, if we are inviting a speaker for her reputation, and that we take license with rephrasing what she's presenting. Does that make sense? I want to be just really careful that she doesn't, that we aren't overreacting, taking it personally that she's talking about us, but more that she's going to talk about this danger in the community. I didn't hear it as pointed towards saying that all white people are white supremacists. I heard her talking, I thought I heard the way you said it, or the way you read it, that it was a statement of a concern and something that she wants to highlight. And there's no better time than right now for that to be talked about more than not. I don't know. It was just my initial thinking about it. And I wonder if she would be, and Betsy, if you're in contact with her, if she wrote that and said, if you don't like this, or if she gave you license to edit it or that sort of thing. I didn't get that was what she was asking for, but thank you for hearing my opinion.
Yeah. And I'm just, I think that you're right. And I'm not saying anything that she should change her presentation or should not present about that. But
Yeah.
I just, I don't know that, you would be attracted to the topic, and I would question whether I would be attracted to the topic. So that was my, and I don't know. Bob, do you have an opinion? You're on mute.
No, I don't have an opinion one way or another.
Okay. Marianne, did you get what we're discussing? I don't know that either you're on mute or you can't hear us, Marianne. So
she is muted.
So Betsy?
Yes.
Now you've heard from two of us.
You have to break the tie. Madam Speaker, you can break the tie.
So
yeah.
Yeah, so I don't know. I think that we have to put it into the agenda that Tori posts, and we have to decide how to put it into the agenda and what to put there. And I mean, maybe it's like a form of a flyer, that she puts it out. So maybe you can. Maybe
this is Marianne. If I could just interrupt a second,
yes.
really challenged with the computer system some days more than others, and I'm catching up on the conversation. So sorry about all this, but I think we need to let the presenter present her material in written form. If we think that's going to be tricky, well, so be it. I think the whole topic can be pretty tricky, and that's why we need to discuss it.
So,
And so
the question is whether in Tori's agenda, how she puts the topic out so that people listen to it. And would it be better to put out that she's talking about racism and racial trauma and presenting strategies to achieve racial healing, or put out that she's talking about white supremacy and
I like the first part better.
Well,
I'd
except
just
that,
like to
is
add
that
more.
all she was saying, Kathy? Was that we're going to talk, she's going to talk about white supremacy? I heard that there was a whole, I heard a litany. I didn't hear just white supremacy.
okay, I'm just going to read it.
Okay.
Supremacy refers to a political, economic, social system of domination. This system of domination is present in Sonoma County, and it is associated with racism and racial trauma. Inspired by Resmaa Menakem's work on racialized trauma, Dr. Daniela Dominguez will discuss how white body supremacy lives in our brains and bodies. She will explain how trauma can be passed down to different generations as well as offer strategies that may lead to racial healing. During this 2-hour presentation, participants will A, learn about the relationship between white body supremacy and racial trauma, B, learn how trauma can spread from one body to another in intergenerational ways, and C, learn strategies to metabolize pain related to racial healing. And that's what Betsy sent to me.
I see.
So I'm thinking about, I want people to hear it. If we're going to spend the money on putting it out there, then I want people to hear it. And the only way they're going to hear it is if they actually listen to it. So, what to put on the agenda when we put it out? I mean, given our opposite reactions.
I'm sorry, I was in transition as Marianne was speaking, so I apologize. I got cut off. Not sure where the voting is going right now.
Well, Marianne's voted with me. Bob has no opinion.
Well, I'll change my opinion too. I think having the white supremacy might be coming to a conclusion and turning off some people. I think the racial injustice is such an important topic that as many people to hear it would be great. So I guess I'm neutral in terms of how to put it, because I guess the goal would be to have as many people participate. So I don't know what.
Well, it's such an important issue in the country today, and affects so many people of so many different colors and backgrounds.
Yes.
I think having a way to discuss some of this, it would be a very good contribution for the Mental Health Board to make to the community, just to offer the forum.
I agree.
I agree with everything Mary is saying as well. I mean, I guess all of us want this to be before the board. Maybe it's because the issue of racism in general and its systemic nature is such a huge topic, and she's really bringing it down, drilling it down to this white supremacy issue that we have, you know, and what we've seen demonstrated in our capital. That's what's newsworthy right now. Mm-hmm. And so she's really focusing on that. And I don't know how you take out the word white supremacy, because she's really, that's what she's talking about, is white supremacy and how it's spreading, and how it gets started and what feeds it. So if you don't use the word white supremacy in the introduction to the board, I don't know how, it feels like we're watering it down. Does she happen to be is she a person of color?
Yeah, she is Latina,
Yeah,
LGBTQ.
yeah.
Um,
So then
yeah,
I have another, and that gives me another level of stepping back from censoring how she presents it, because I think I feel like as a white person with privilege that I need not do that. But anyway, that's my politic, not necessarily shared. So
Betsy, what's your opinion?
Betsy. Oh, yeah. So I just saw a presentation of hers that she addressed with all English language learners, teachers, professors, admin, all those invested in that topic. And she talked about white supremacy, and she called it out from the very beginning. I'm and she had good attendance, but of course there are comments, about the presentation, because it is an uncomfortable conversation, and oftentimes it takes several of these conversations for one to start assimilating the topic, or learning more about it without feeling attacked or feeling it being personal. With that said, I'm okay with whatever this group decides on, because I'm more interested in having the information out to our community. However, I'm also thinking about, so if we send the message, this is about XYZ, and yet when we come into the meeting and we hear white supremacy, those people who come in may feel that tricked into coming in, right? And how does, I feel I don't know if that's really our intent, is to do that. Um, so yeah, I just wanted
So
uh,
what about putting in white supremacy, but not okay? So I'm gonna tell you what I'm thinking. The topic will be addressing racism and racial trauma, including white supremacy in Sonoma County. So it puts it in, but it's not like
front and center.
body slamming you.
That sounds like a good compromise, Kathy.
That sound reasonable? And just leave it at that. I mean, we don't need to have the public with the whole, white supremacy, the second part. But if we put including white supremacy,
as if you're calling it an after, she might even talk about that. She's going to include that too, but that is really not what she's doing. The whole thing is about white supremacy. Her entire lecture sounds to me like the focus is this movement that is 74 million people subscribed to and voted this last year. I think it's misleading. And I think that I think we have to pay attention to being offended by it.
yeah.
And why are we offended? Why is it offensive to anybody?
I'm willing to go either way. I'm looking
Okay.
for audience.
Is it possible to just do, say, presentation by Doctora Daniela Dominguez in a flyer format, and just include the description with the goals as she presented it? I mean, the language is rough.
That's writing.
That is her writing. Yeah, that's her description and the goals that she will meet. So we're not calling it anything necessarily. I think we're just saying presentation by Doctora Daniela Dominguez, description, goals. I don't know. Usually that's pretty common in flyers that are sent out to community with a brief description along with some goals, and those who feel they'd like to attend will attend.
Okay. So, yeah, and that's true. Um, it's totally true. And the reason that I would have gone, like I've said, the other way is that I think more people might actually attend. But you're right, Patricia and Betsy, that if this is her topic, this is her topic. And okay, so are you guys okay if um, Betsy and I figure out the flyer, or should we hear from Carol and Becky since they just popped in?
I apologize for being late. Carol and I both just came from a connection capacity and change meeting, but I am gathering that we are on the topic of the presentation by Dr. Dominguez.
Yes.
Mhm.
And I'm
So-
sorry, there seems to be a little bit of a kerfuffle over something, and I don't understand what that is exactly.
Okay, so
Yeah,
here's
I also don't understand. I kind of came in late as well. And also, Kathy, you're very soft. I can hardly hear you.
well, I don't know why that is. Am I better?
That might be better. Yeah, I don't know if it's the same. It might just be me.
I had a piece of paper over my computer, so I don't know where the microphone is. I could have muffled it or something. Okay, so here's the question, and the presentation is basically about white supremacy and including white body supremacy and racial trauma, learning how trauma can spread from one body to another in intergenerational ways, and learning strategies to metabolize pain related to social healing. So my initial reaction was, well, I don't know if I would actually listen, on purposefully attend because white supremacy is associated with groups of people that I necessarily wouldn't want to be associated with. But so I was thinking that maybe it should be, her topic would be addressing racism and racial trauma in Sonoma County, including white supremacy, and presenting strategies to achieve racial healing. And the other side of it would be just go with, she's presenting about white supremacy. So we had a discussion about which my purpose would be in getting people who had that initial reaction that I had to attend and hear the information versus just putting it out as she's talking about white supremacy and leave it at that, which is what she's talking about. So we're split on it, and I think that we ended with maybe we should just go with the white supremacy, and who comes.
Is it possible to get the author or the presenter on the line and just give her feedback? She may have a different title that she feels like she could work with, given the feedback.
May I add something, Kathy, to what you just said? It isn't that it would go out as a lecture about just white supremacy. It's all of those things that Kathy was describing. And what you didn't get to hear is how the lecturer describes her presentation. And the question on the floor is, would it be all right if we change the way she describes her lecture to remove the word, she starts out defining white supremacy, to change it to her lecture will include white supremacy. So my my objection is she's the presenter and we've chosen her for a particular reason. And white supremacy is a huge issue right now, challenging our entire democracy. And this is what she is talking about. And so she gave us her presentation introduction. And the question is, is it okay if we change that to, in particularly, to soften it so it isn't off-putting? And I'm objecting to that.
Yeah, I think if we've invited a speaker, I think we have to honor that speaker. If she's going to speak about a topic or in a way that we feel is not compatible with the mental health board, that is another discussion altogether. I do not think that we should edit our speakers. Give her feedback and allow her input. I don't think we should edit.
And Tori has sent over the language in an email.
Yeah.
So all of you can
We need
review
to
it.
be at the table.
Okay,
I'm going to chime in with Patricia and Carol, not to belabor it, but I will stand there.
okay. So, Betsy, if you put together a flyer and then pass it by Tori and whoever, and we'll get the agenda out then.
Absolutely.
This is Marianne, and I might be too off the wall here, or too sensitive, but I'm remembering, I can't think how many months ago it was, but there was a really obscene display, I think at a board of supervisors or something, where Barbie Robinson and Dr. Sundari Mace were, I don't know what to call it, but it seemed like a horrible racist attack on them as two of the primary leaders of the behavioral health department. And so I'm thinking they need to know that their mental health board is considering this and considering it as something that would be instructive and maybe a path to healing for the community, to talk about some of these really tough issues in a more constructive way. But I think we need to honor them by letting them know where this is a topic under consideration for one of our public meetings. Maybe I'm off the wall here, reaching too far, but there you go.
I think it's appropriate, and I think that it's also appropriate since Bill couldn't be here for him to know as well.
Yeah, oh yeah. I guess I thought he was just a black box here, but you're right, he's not here. Okay.
Yeah, no, he's not here. So I will pass it. I will pass it by Bill, and he will, I'm sure, talk to Barbie. And Becky, I'll include you in that conversation, because honestly, we really didn't know exactly what her presentation was going to be until, after you had talked to her. So that's a good suggestion, Marianne, and we will work on that. Okay.
Thank you, Kathy.
Okay. So does that sound comfortable to everybody?
You just summarize the plan again, Kathy?
Pardon?
Just summarize again the plan.
The plan is to, Betsy's going to make a flyer that includes the information that Dr. Dominguez sent us. Talk to Dr. Dominguez and see if there's any,
That's good.
Betsy explained the situation that we discussed, and see if that's what she still wants to have on it. And then I'll talk to Bill, maybe with you, Betsy, and we can describe the presentation and have him talk to give Barbie. And who else was it, Marianne, that you suggested? Barbie?
Well, Barbie might want to let Sundari Mace, Dr. Mace know. The two of them had sort of it was a racist attack on them at one of the county public meetings, really ugly sort of thing.
Yeah, and we need to be prepared that, you know, it is public, it's publicized, that we need to be prepared to decide what we're going to do if something like that happens. So I assume that we would just end the meeting. That will Betsy and I will talk to Bill and go from there. That sound okay?
Sounds good.
Sounds good.
Okay. So oh, the other thing with that is that her presentation is 2 hours. So I think that we would have to do our board business before. So start at 4:30 instead of 5.
Just a suggestion. One of the things that Path to Hope did in their presentations was to have a couple of people on standby in breakout rooms to support individuals that were triggered. I don't know if we have the capacity to do that with this particular topic.
I don't know either.
I could certainly make an ask of my team if there were a therapist that would be interested at that time.
So what was that offer, Becky? That you would
Well, I can take it back to my clinic and ask if a therapist might be available to be in a breakout room should there be an individual that's triggered by the topic, as I understand it. I mean, I do recall the Path to Hope, some Path to Hope events did have that. I don't know how many people actually took them up on it, but.
Well, we can check in with Erica too and see how that worked.
How do we have a breakout room when we're on Zoom?
There is the capacity to have breakout rooms on Zoom.
Ah.
Yeah.
This is a webinar. Is it a Zoom webinar, Tori?
Yes, it is. And so I'm not sure how to do a breakout room from the webinar. I can talk with Carol if she knows how to do it and work on setting it up.
Because somebody might need that as a confidential conversation or something.
But
I'm sorry. I'm so.
Yeah, which is also fine.
Yeah.
Okay. So yeah, and I it's complicated, but I will.
Yeah.
Breakout rooms. Carol, do you know how to do that?
I've used them myself. You may need to set it up. The session, when you set up the session for that evening, you may need to set it up. The person who has who is the host, at the bottom where it says participants, question and answer, chat, share screen, record, if the meeting has been set up with the capacity to do breakout rooms, the little button for breakout rooms will be on that bottom strip.
Okay, I'll research how to set it up that way and practice it before the meeting.
Yeah.
Okay.
Kathy, Erica might know.
I think that Erica might know.
Yeah.
Or she would know who to send you to help you set it up, Tori.
I just think we need to respect, if somebody needs that, if it's triggered something, they may need the confidentiality as well. And I just, I'm not that savvy with all of this format to know if that could be protected, confidentiality.
Okay.
And maybe Kathy and Betsy, in conjunction with the speaker, you can maybe come up with some contingency plans. If we do have hecklers or people that are unwilling to go to a breakout room but want to disturb the presentation,
Ah, yeah.
that we agree that we just close it down is the, you know, for sure would stop it. But I don't know of any other way to intervene. You can certainly block individual participants, but I think we have to be careful with Brown Act that we are blocking people's free expression. So I'm not sure what the laws are around that.
The, that's a good point. I thought two things. One is at the beginning of the presentation, we could list some resources to call if people were triggered by the information or the conversation, so that they could leave the site and go to that site to talk about any trauma that they were experiencing as a result of the conversation or the presentation.
I like that.
And also, freedom of speech doesn't include hate language. It doesn't include inciting people. And so blocking someone who was disruptive of the proceedings after being asked to stop would certainly not be a violation of the Brown Act. The Brown Act has, I mean, we've made it public, but they don't have a right to come into any meetings and, you know, and be disruptive. It's one thing to contribute. It's a very different thing to be disruptive. And that's not protected by the Second Amendment, the First Amendment, sorry.
Yeah, then maybe having someone that was designated, I'm not sure if that would be you, Tori, designated to block someone who was being disruptive or rude.
Yes, I can definitely mute them, and especially if they're participants, I have to allow them to talk. And then if they're getting carried away and Kathy identifies them, then I can mute them and they cannot unmute themselves if I mute them as a participant.
Okay, because I think if we have some of that in place ahead of time and we know what we want to do and how we want to handle it, then I think this is a really good topic and conversation that we really do need to have as a community.
Mhm. And I remember because of the result, as a result of what happened with Dr. Mace and Harvey Robinson, the CDC, before starting any meetings, inserts a clause around we will not tolerate hateful speech and such. And if that were to happen, then we will, I don't know exactly how it's worded, but I do know that our chair, Oscar Chavez, makes sure that that is said before any meeting. So what, maybe we could do something like that.
Yeah, I like that idea too.
That's
Yeah.
a good idea. So I think that it's just us that will be panelists and the rest of the people will be participants. So the way that they would get into that would be through the chat. And so can you block the chat, Tori?
That I'm not aware of. I would have to research that.
Sorry.
Can I? Okay.
And yes.
Yes. Wait, but if you have to do it, so I think you've already sent, have you already sent the link out for the February meeting? Yeah.
No.
So when you set it up, it's all in that section of setting up the webinar, who gets the panelist link, who gets an attendee link. Is the chat feature available? Is it not? Is it just Q&A? Do you have any of it all? Do you only have raise hand? Like it just, it's all within your control, but you have to do it when you set it up at the beginning.
Okay. I will make sure to look at that and practice with it.
Okay, so do we have something of a plan on this? Okay. Okay. So we shall be talking, Betsy. Sorry about that phone. I have no idea where it is, so it's just over there. Okay.
So I just want to say to everybody, this was just a great conversation for us to have, and I just really appreciated every bit of it. And I'm really proud of us for talking this through and figuring some things out about how do we protect the program and how do we honor the speaker, and we also honor ourselves and our integrity. So great conversation. Thank you.
Okay. So let me just make sure there's a, well, okay, so Sherry, we talked briefly about the Drug and Alcohol Board, and Bill couldn't make it to this meeting, so we really need to talk to him about that. So we're putting that onto the next meeting agenda.
Thanks.
Uh-huh.
Sorry I'm late.
Not a problem. Several of us had trouble getting in. So the Board of Supervisors, the next presentation is March 2nd. I've communicated that to Becky. How did it go, Becky, when you presented?
There wasn't an opportunity to present, Kathy. The board moved from item agenda number 1 to item number 41, and we were number 17. So because we were on the consent calendar, I was not given the opportunity.
Okay. Okay, I'm not sure how to get around that. Bill told me that he told me we were going to be on the consent calendar, and that we'd have to insert ourselves in public comment. So I'm not sure exactly how to get around that.
Well, I was not able to go yesterday, but my intent is to go back and take public comment for that opportunity. And that I own that might have partly been my mistake, because I wasn't, when public comment started, I had entered the meeting, and so it was already going on at the time that I entered the meeting. I'm not sure if I needed to get into the queue. But anyway, my intention is to go back and to state, that we're here, that we'll be back March 2nd, and that if we are on the consent calendar, I would like to be present and able to speak to it. Because they certainly took a portion of the consent calendar. They did have, for example, item number 1 was an open space initiative, and it was on the consent calendar, and there were multiple people there to speak to that initiative prior to then jumping to item 41.
Wow. Okay, well, we'll figure this out. At least it's been officially submitted, which hasn't happened before. And thank you for your efforts in trying to get heard. So the next one's March 2nd, and maybe between now and then we can figure out, how to do it better. Okay, so I'm just looking back and making sure we've gotten everything. Okay, so let's we've got half an hour, so we're good. Okay, so the other reports, including Comboard and Cam and the jail needs. So the PAM committee, the visits.
Yes.
Yes, Bob.
I sent out a note to the Mental Health Board at the end of December and included the revised forms that we would complete: a site visit report form, program manager, director, and staff survey, adult consumer survey, and if it's a children's program, a parent survey. And the goal I explained was it would be great if we could do average one a month. If we did one a month, that'd be 10 a year. If you had at least, excuse me, 4 board members conducting the site visit, and that would be 5 visits a year. But I didn't hear from anyone except Becky, who responded, said she'd be willing to do a site visit. And these would have to be all by Zoom. But the number was really didn't get enough people interested outside of Becky. And so, well, maybe that's too ambitious. If I need someone else, I think you need to have two people conduct the visit, so then after the visit, they could talk about their findings and prepare the report that would go to the whole committee, the executive committee, and then to Bill Carter. But I didn't find much interest at all from anyone doing it.
Okay, I didn't respond directly, but I'd be willing to do site visits. How about the rest of you guys?
Yeah, I thought I did respond, but sorry that I didn't. I'm the same. It just depends on the time and place, day, time and place.
I'm willing to go to site visits. This was at a board meeting probably 2 years ago. We talked about making sure that new people coming onto the board and that board members generally would agree to do just among them 3 site visits a year. And we created teams of interest. Like some people are more interested in the juvenile programs or the children's programs or the senior programs or the behavioral health programs. And we named all the teams and people put their names on the board and which teams they were going to join. And then it didn't go anywhere from there. No one, they didn't get scheduled. And then COVID came, along the next year or the year after that. But so this is a long-standing problem, and in terms of trying to get, and we also, I think, decided that it shouldn't be 10 people showing up for a site visit, that it'd be better use of our resources because is there 15 of us? This is at the core of our mandate, is that we check to see, we go in and we look at these programs. It is the core of our mandate. And we, separate and apart from the pandemic, it's been just dismal. I've been on the board for maybe only 4 or 5 years. I've only been on 2 site visits. It's ridiculous and terrible for me and for our mandate. I mean, we don't know. We're not holding anybody accountable. We're in violation of our mandates. It's so frustrating. So I sympathize with you, Bob. We had the same experience on the PAM committee 3 years ago, or 3 years ago.
Carol?
I think I know that the board is tasked with some review of the services that are provided using MSHA funding. I'm not sure if it goes outside of MSHA, if it's all service provided but with government money. But I think I am, as a relatively new member to this particular process, unclear about what our role is. If it's to hold people accountable, how do we do that if they present their best face to us? And if it's just to be aware of and to be informed about the programs, I think that's a different mandate than holding people accountable for, providing a particular program that they said or service that they said that they were going to provide. Is that not the purview of the RFP process and the contract arrangement? So I'm happy to help out, but I am not clear about the purpose. So, maybe if there's a presentation about exactly what, where is this report going to go to? What will be the consequences of the contents of this report? I think that would be very helpful.
Well, it's the PAM committee, at least in the past, the report was going to be completed and shared with the Mental Health Board Executive Committee and then with Bill Carter. And I sense that I did 3 of them last year. And I always sensed that the purpose was to be better informed about what clinical services or administrative services a particular agency provides. And I think what was striking was they're quite appreciative because often they don't hear or get much contact with anyone from the mental health or behavioral health division, but just having a community representatives kind of have an understanding of what they do, I think there was a very positive response. So I don't see it necessarily evaluating the value or how they're presenting their materials based on the contract, but just understand what they do. And it could lead, if that's what they do and no other agency delivers it, maybe it's time to develop another program to fill in the gaps. But it wasn't, I never sensed it as a core evaluation process, more assessment of what they do. And then in some recommendations you have in the report form itself, are there any suggestions for improvement? Often was lacking essential funds that they could use to provide all the services. But I found a very benign experience and very positive in the sense we could educate others or community. I think another way to communicate the findings would be at a mental health board, just summarize that the site visit was conducted and this was the findings, and hear from the community. Do they have any suggestions or comments concerning the services? Would be, I think, excellent idea.
Because I think that how we frame the visit is really important as to how people will show up for that visit. If they feel like it's to, showcase the amazing work that they're doing, and to kind of maybe discuss some of the hardships and, trials and tribulations that they faced, and that they see us as an ally, I think they will show up in one way. But if they see us as an evaluator, and a, someone who's going to be critical of how they are providing the services, they may be less likely to want to show up, and we may get a less honest, especially if they feel like our reports will have any impact on their funding.
Well, again, the intent that we provided was understanding of their services that they provide, and based on that, a report would be formulated, and they would get a copy. They get a copy of the report. And in fact, my idea is actually give them the program manager and staff survey that we're going to go down and ask them. So it wasn't any. It was pretty benign, I think, and because the intent was to be helpful, just like our contact with the jail services. It's not to expose necessarily things they're doing wrong, but to identify what they're doing and where their suggestions, how the services could be improved. Because I don't think, well, when we were involved with the jail programs, I don't think we were there to critically assess everything, but it was more to have understanding of what they provide, and then to learn what other services could they benefit from, like another discharge planner, for instance. So things like that.
Okay.
For advisory, I don't think that I think that all we can do is learn about what is there and let Phil know what we found. Even if we wanted to be evaluators, there's no teeth in what we would do anyway. So I think that that using it as a learning tool is probably the best use of our time. I don't know that. I mean, going in and evaluating and expecting change, I don't know that it would happen anyway. Sherry?
Kathy, I just based on past experience, because there was a time when we were very active at site visits. With the last 5 years, maybe things have kind of gone by the wayside, only because the infrastructure of behavior health kind of went by the wayside for a while. So now that we're regrouping and more programs are, more people in charge of programs are being employed, and the infrastructure seems to be building out again. Hopefully, so it's going to continue this way. Will give us more opportunity coming next year, I would say, when COVID lets us open up a little bit more, to be actually at a site visit, go actually to the place is, in my past experience, is much more beneficial to see, to be able to see the facility. Like we went to Petaluma. We've made in the past year, recent years, made a site visit to the Petaluma services, community services, and it was really cool to see what was happening there. So I think that we are, to say what Kathy said, is that we are advisory. We're not, it's not our mandate to be overseers, but it is our mandate to know what's going on. And that has come up way back when with one particular program that there were some problems with, and that was in the very beginning of the Mental Health Service Act, and some change came out of that site visit in a positive way. So I agree with Carol and Bob. Both your statements are correct. I think we don't want to be in an adversary situation. We want to be in a welcoming situation. We want to, it is our role to find out what is going on, but in doing that, we want to be friendly and keep that open door thing going back and forth. And in the process, the things that we see that maybe should be changed will come up in conversation, and then that's important to take back to Bill, because he's the one in charge to make those, in position to make those changes or have those changes come about. But definitely we need to make sure that the programs are doing what their contracts say they're doing, and that our clients are best served.
So just to summarize for my
Can I
own,
just add something before you summarize, Carol? So Sherry really she just underscored that we really do have a mandate to see if they're meeting what their contract says that they're going to do. It's a check and balance. We advise the board is what I wish somebody could put their finger on that statute. There's actually a statute that defines exactly what our mandate is. And it is to look at the programs. And of course, there, from 99% of the time, we're going to walk in and be really pleased to see, hopefully, what we see. But holding people accountable is a respectful thing to do, by the way. It means that we expect them to do what they say they're going to do, being their word. That's a good thing. But there's no question about it that we are there to see how if the residents are being provided what their contract said they were going to do. And there's actually a whole format for that. And that's what, when Bob was referring to all of those surveys, those questions have to be asked in exactly that way in order that they have credibility. Because I remember once saying to the interim director, no, not the intern, it might have even been Mr. Kennedy. Well, what happens with these reports when we turn them in? And he said, well, we don't even read them. Because there's such a wide range of people asking questions and they're not standardized. And so we worked for a year to standardize the questions in those surveys. And both, there were two of us who had been trained in graduate school to create those kinds of questions in terms of doing assessments and to give them legs. So the surveys can be very helpful in that way. And it's definitely, we're definitely there as the advocate for the program and for the residents and the care. And it's really not an unfriendly situation, but it really is our mandate. So I don't know that we're not there to see how is it going and making sure that their contracts are being fulfilled, which is what Sherry articulated so much better than I'm doing now. But we just maybe need to throw that piece of legislation in front of us again, that one code section that has our mandate in it, because it really does explain it really clearly. And I could go find my files and pull it out, but I know that you all see that. I'm sorry.
I'm not sure if we have time to do it now, but I do have it in front of me right now. It's section 56042.2. And the first item is to review and evaluate the community's mental health needs, services, facilities, and special problems. Review any county agreements entered into pursuant of section 56.50. So I think there is a mandate there. I think we have to be very clear about who is going to read this material. And I see us, the 15 members on the mental health board, as the primary readers of these reports. And if there are any red flags, that we would then highlight those red flags to Sonoma County Behavioral Health. And if we didn't have any joy with that, we would then move on to Board of Supervisors, since we don't have any authority other than to evaluate.
Carol, what you summarized in the site visit protocol that was developed, both those items are in the protocol. That it's part of the packet. And then the idea being, it says the data gathered will measure the impact, efficiency, and visibility of a program, as well as qualitative data associated with the services being provided. By consciously answering these questions, the contract agency will be providing critical accountability. So
Do we have copies of the RFP of what these agencies have signed up to do, to provide?
in the
Before
past,
we go to a visit, they're provided to us.
yes.
Okay. Okay, so we have some comparison. We have something to compare. Okay.
Where may I find the language you're reading, Carol and Robert?
I can put the link
No, it's already in the forms I sent out. And there are several
in
forms.
the chat, or I can share my screen, whatever we have time for.
Kathy, you're on mute.
Thank you.
It's
Yeah.
the Welfare and Institution Code, WIC code, and Carol gave the number 56.
Mhm.
Or was it?
4.2.
5604.2. The site is actually the Sacramento site, but they're basically quoting the code, and it's got 8 points.
Should be in your handbook, the information that you got as a new member. I can't remember when you came, it was Rhonda or Tori, but somebody should have given you a binder with some information in it, and that's in that binder.
I've just put it in the chat box.
I just wanted to let Betsy and the newer members know that there's a wealth of information for them as a member as to what our duties are.
It may have been because I came in during COVID that I didn't get the physical binder. I don't have the binder.
Okay, then we should know if anybody else, because there are some other new members, we should know who doesn't have that information, because it's important for you to have.
Yeah.
You can also go to the COM board site, and there's a wealth of information.
Yeah, right, absolutely.
Okay, so Bob, there were several people said they were available to do or interested in doing site visits. So
I have Becky, Kathy, Sherry, Patricia, and Carol,
And Betsy.
and Betsy.
okay, and so the next step would be to set up a site visit. And I know that Bill didn't have a good list to give
No.
us, but we had talked about doing CSN, and that might be a good place to start. But maybe it needs to be more specific than just CSN as a general. Like when we talked to them before, they were going to take us from one place to another, and they actually, it's a big program, so they have smaller sites within.
It's much more meaningful to actually visit the site rather than just do it by Zoom. It was just
Yes.
really interesting. And we also visited the crisis stabilization unit, met with the staff and so that. But No, I just think to do it, it's important to visit, to have face-to-face, like Parker Hill, we went to and saw the facilities, interviewed a consumer, interviewed the leadership staff. But I think to systematically go to these sites and develop some program or plan would be desirable. But then, as you alluded to, just to complete a form and it doesn't go anyplace, it just goes, sits in a file, doesn't make any sense either.
Well, the leadership that we have now in Bill Carter, I think is different because it was, I think that it was Mike Kennedy that was in charge when Patricia was working on it. So major changes, and I know that Bill does read them. So I think that that's a big change.
Kathy, if I could just also mention that in these most recent years, the structure or the infrastructure, or the structure of what the mental health services, behavioral health services are to do is where we are now through the Mental Health Service Act, each county's behavioral health board together with is responsible to the Board of Supervisors, so they know what's happening with us, hence the importance of our reports going to them. All of this goes up to Sacramento, and that is, I do know that although since COVID there hasn't been, I haven't attended in body to COM board meetings, but I do know that the COM board, the Directors Association, and the, now I can't remember the third body, but they work together to present the information we gather at this county level to the legislators to get funding, to get change, to have the opportunity to have better services for our clients throughout the state, county by county.
So, Sherry, so what you're saying, Sherry, is different than what Bob's saying, I think. Because Bob was saying that the reports go to the executive committee and to Bill.
Right.
You're talking about them going way.
No, what I'm talking about is exactly what Bob said, but our what we do at this county, that news of what we do goes to the COM board, and the COM board puts it out there. So if you want to go to the COM board site, you can see what's happening at other counties.
So you see that site visits are happening, but not necessarily the nitty-gritty contents.
Exactly. Well, that they're happening, and maybe through our visits, a highlight of something like their visit to the jail, what's happening there, will go on best practices. So it goes out and throughout the state, another county may pick up on that and say, wow, that's something that we haven't been doing that maybe we should look at, and they'll do. So I'm just saying that there is a connection to what we do and why the site visits are important in that connection.
Right. Okay, so that took us a while to discuss. So we've got now 4 minutes again. I want to jump to 8 really quickly. We said we were going to acknowledge a person or program every month, and Becky made the suggestion that since February is Black History Month, that maybe we should have somebody, a person, what is it, BIPOC, Black Indigenous Person of Color, present something, maybe a poem or something of that sort at our meeting. And I was thinking that maybe we should acknowledge the program at the Baptist Church that works with youth. They're MHSA funded. would that be a good one to do this month?
Excellent. I think that would be really good. I think too many members of our citizenry don't understand that we do, that's thankfully this board now does represent better the different members of our community that are receiving better behavioral health services. So I think that program is excellent in showing that money goes to them and what they do with that money, because I think it's excellent stuff.
Okay, any objection to that? Okay, so I will contact that church and get that going. Okay, and then at some point, we don't have time today, but at some point we need to talk about what happened at the retreat and come up with what we want to do with that. A statement was the goal of our commitment to trauma-informed care. I put on the Jamboard that everybody received, I typed on, I think it's the third page, a possible beginning of a statement. If you guys want to look at that and we can address it, you know, you can make changes or whatever. I made a copy of what I did, so I think that you can fiddle with it and do whatever you want with it. And you know, I've got the copy of what I did set aside, so we can discuss that maybe at our next executive committee meeting, because we're running out of time. Maybe we were considering moving our meetings to Wednesdays. I asked, and I don't know that it's going to make that much difference with supervisors coming. I know that their meetings usually go late on Tuesday, so maybe they could come, you know, in a more timely manner. But at this point, we've had 4. Have we had 4? I think 4 of the 5. No, we've had 3 of the 5 supervisors have attended a meeting. The 3 that were in the, you know, the remote areas. Linda Hopkins hasn't attended, and Chris Kersey hasn't attended, but Chris committed to attending a meeting. So that would be half of the meetings we would have supervisors at if we can get Linda and Chris at a meeting. So we can check and see if people would be willing to do Wednesdays, and if they would be open to it, but I'm not sure that it's necessary. That's maybe something that since we've got 2 minutes to discuss it, maybe that's something that we discuss at our next executive meeting as well. So, Sherry?
I would just say also this recollection goes back when our meetings were filled with staff, when we had program directors and in the different categories of services. So I think we included in the questionnaire about changing from Tuesdays to Wednesdays, we should include through Bill that him canvassing his staff to see if that change is agreeable to them as well.
Yeah, so I mean, we could have Tori put out a poll again. At this point, I think everybody had responded that Wednesday would be okay, and Fran was the only holdout, but she has since then said that she would also be available. So I think it's just a question of whether it's a necessary thing to do and whether we want to do it.
Right.
So
just clarify, the poll would include our members, the staff, and the MSHA program people too?
Well, I think first of all, we need to know us, and then we could put it out just to the general the people that actually come.
I'm just seeing,
No,
yeah, I'm just looking at past audiences.
right,
We
right.
had audiences.
Yeah, and we do have audience. I mean,
Right.
we actually do, because we usually have at least 30 people at any given meeting. So we do have audience.
Okay.
So, okay, it's noon, and I think that we covered almost everything. So, Lori, do I need a motion to adjourn this one?
Sure, why not?
Okay, Bob, motion to adjourn.
I
Mary
second.
Ann seconds.
Perfect. Okay, so I'll get in touch with the Baptist Community Church, and I'll get in touch with Bill about our topic. And we will plan, as long as everything goes fine with Bill, etc. We'll plan on starting at 4:30, so that we can get our board business out of the way before the presentation. Okay, meeting is adjourned.